Every year in the United States, more than 16 billion with a B, prescriptions for medications are written for patients. And in fact, nearly 3/4 of all visits with a doctor involve prescribing a medication. Now, people are familiar with the most common side effects: nausea, it could be fatigue, anxiety, increased immune system dysfunction, and increased susceptibility to infections with some medications. But there's one incredibly common side effect of medications that doctors don't even talk to their patients about. And in fact, most doctors don't even know for the vast majority of prescriptions. And that is osteoporosis and increased fracture risk. Did you know that common medicines like acid blocking medications and the proton pump inhibitors cause osteoporosis and increased fracture risk? Did you know that the most common antidepressants on the market, the selective serotonin reuptake inhibitors like Prozac, create osteoporosis and increase fracture risk? And the list goes on and on. Diabetes medications, anti-seizure medications, aromatase inhibitors that are used for treating breast cancer. And the majority of women who are put on that medication don't even get a baseline or an initial screening, a bone density test before they're prescribed that medication. And for all the medications that I mentioned, doctors are not doing baseline bone density tests. They're not following up with bone density tests to check and see if risk is being increased. And most importantly, they're not even talking to their patients about it. So it's important to understand that side effect, what you can do about it, and if there are alternatives if you have to be on a medication. Or even better yet, seek out an alternative that allows you to get off the medication. I'm deep into the research right now on this, finishing a 2-part series, professional article for a medical journal on osteoporosis. And I wrote a blog on medication-induced osteoporosis for some of the most common medications that cause this problem. So I'm going to link to that below. Go ahead and click to that. Click on that link to read the blog. When you're at the MBI website, sign up for the MBI newsletter to get health tips and information like this directly into your inbox. And check out our podcast. We've got some great podcasts. There was one released just recently on diabetes from an integrative diabetes expert and clinician with over 30 years of experience, Dr. Mona Morstein. So take a look at that on the podcast section of the MBI website. It's also on iTunes and Spotify. Make sure to like and subscribe to the podcast as well. And make sure to educate yourself on these medications that you may have in your medicine cabinet right now may be stripping your bones of calcium and connective tissue and other nutrients that create the situation where you'll end up increasing your risk for fractures, which nobody wants.